Let's talk about our sight now. Let's talk about our eyes. It's World Sight Day today, and the focus, as it has been every year, is on blindness and vision impairments. Let me introduce to you my guest in studio is Dr. Titiati. She's an optometrist and public health expert, also with PEMF Eye Care. Good morning to you.
Good morning.
And thank you for being here.
Thanks for having me.
Okay, great. Joining us via phone, though, is the president of the Optometric Association, Dr. Remy Ningpe. He's joining us via Zoom. Can we say good morning to you as well, Doc? Maybe not quite this time, but we can certainly come to the studio. Doc, tell us why this day is important, first of all.
Yeah, World Sight Day tends to draw attention and create awareness on blindness and vision impairment because, not boring you with too much statistics, 1 billion people in the world has vision problem. And in Ghana, we are stopping number 2 in causes of blindness due to glaucoma. So it has become important that we let people know about the eyes, because it's also been established that 80% causes of blindness and vision impairment are preventable when it's detected early. So we are always interested in informing and saying that take care of your eyes now, because whatever that could lead to blindness, whatever that could cause vision impairment is preventable. That is why World Sight Day, in conjunction with the International Agency for the Prevention of Blindness, have stipulated every second Thursday in October to create awareness, where we also take the advantage and take care of people for free so that people check their eyes and know their eye status.
Okay.
So somebody might ask, what is blindness and what is vision impairment? Basically, blindness is no vision. Vision impairment, anything that doesn't make you see. Vision is 100%. So anything short of 100%, you have vision impairment. And there are so many causes of vision impairment. Number 1, uncorrected refractive error. That is basically if you need glasses to see well and you don't use it, you have vision impairment. Yes.
Wait. But if you use the glasses for a while, you can do without it, right?
No.
Doesn't it correct the eye?
Glasses is not supposed to cure, but it corrects, like you rightly said. But people always think that when I wear glasses after 2 years, I'm supposed to stop. No, it only corrects when you wear it. Quickly, what glasses does is the eye, anything you see have to go and fall on the retina, which is the back of the eye, before it's taken to the brain for interpretation. But mostly you are not seeing because the light is either falling just in front or behind it. So the glasses just focuses the light to fall exactly on the retina for you to see. So when you take off your glasses, light goes back to wherever it stays. Then when you wear it, so after some years, it will still stay. It is only in few circumstances where people who have their images falling behind their eye or behind the retina becomes better with age, especially the children, because the eyeball is growing in size. So if the image is falling behind the retina and the eyeball is growing, it grows to the retina with time. So that is why after some years, such group of people will not need glasses again.
Okay.
But when your image is falling already in front of the retina, as you go, the eyeball is growing in size. But we call it a metropization. Yes. So as you go, the eyeball grows. So the image is still in front of your retina. So you realize that you see your eye, especially you see optometrists, and every year we are changing your glasses and it's not getting better. We are not curing with glasses, we are only correcting.
Okay.
Yes.
All right.
And there could be nothing wrong with the eyeball, but it is the vision, and glasses is just sitting in front of the eye.
Okay.
Is that okay?
Okay.
Then another cause is cataract. Simply, cataract is, the eye is a room, it's a door. So when there's cataract, it means there's something like a curtain or a blockage in front of the door to your room. So vision becomes blurry. It starts gradually like a fog till it becomes totally opaque and you can't see anything. So there's a simple procedure where that block have to be taken and vision comes back, you know. Then another part which is of so much concern for me as a public health expert is the prevalence of chronic diseases like diabetes, hypertension, which is becoming rampant. This condition also affects the eye and reduces the quality of vision, and of course leads to vision impairment. When you don't check it early, you can bleed into your eye from diabetes, hypertension, and when you don't check early, it affects the vision. So all these things are worth considering. That is why you need a regular eye checkup, because we can detect the early stages when you have them.
Okay.
Then we have trachoma, which also tends to affect the eye. But fortunately, Ghana have eradicated trachoma, yes, which is a good news for us. Then we have what we call glaucoma. And that one is the silent thief of the eye. When you have it, nothing shows you have it. Even glaucoma patients tend to see better. Yes, so it's difficult convincing them why they have an issue, but because of education, we let them appreciate that glaucoma is due to high pressures in the eye that tends to destroy the nerves, and then gradually, and it's like, I always say that glaucoma behaves like a broomstick at home. When the nerves are dying, it's taking the broomsticks one after the other. So even if you are left with two, you still see. So it doesn't make sense why you need to be managed for it. But then we keep encouraging, and we are forcing, when you have glaucoma, we are forcing you to take good care of your eye.
So how do you know you have it, like, especially when you won't show anything?
Nothing.
How can it be discovered then?
So that's why you need to check your eye regularly, at least once a year.
Okay.
See your optometrist, see your eye specialist, and get your eye tested.
So even if I think that there's nothing wrong with my eyes, because I can see clearly, I don't have any issues, I'm not tearing, there's nothing unusual, I should still go and
check
see
your
the eye doctor.
You should still check your eye.
But how many of us do that? Because we only go, it's just like the dentist, you only do it when
you have a problem, which shouldn't be. You know, that's why we're talking about World Sight Day. That's why we are talking about the eyes every day, you know. And then the other causes are the trauma. When there's trauma, it can also affect your vision. And then when there's also cornea, we are in technology. Everybody is using screens. COVID has even increased the rate at which we use screens in globally. Everywhere, everybody is using screen for work
on your phone, your tablet,
and all
your
that, you know. And when there's vision impairment, it affects every aspect of our social life, personal care, the community, how you even adjust to things, even at work, you know. Of course, my work doesn't end when there's blindness. We have vision support for people who are blind, and they live their normal life to the full. If in case you are blind, with all apology to those who might have vision disability, there's always a way so that they can still live their life. We support them, we provide them care so that they can still adjust to their environment. But then again, we're also saying if you are fine now, we can prevent that because of the psychological trauma, the social discomfort that comes with blindness. Okay. So it's World Sight Day.
Okay.
And we say take care of your eyes.
Okay. Let's try and see if we can now bring into the conversation Dr. Remy Nikpe. We won't quite see him now, but at least we can hear him speak to us. Doc, if you can hear me, a very good morning to you, Dr. Remy Nikpe. Dr. Nikpe, if you can hear me, good morning to you.
Hello, good morning. Can you hear me?
Yes, I can hear you loud and clear now. Thank you for joining us on this very important day. We've been talking about basically why this day is important, but I want you to speak to the Ghana-specific issue in terms of how blindness and vision impairment has affected us. If there are any statistics to share with us.
Yes, good morning again. Thanks for this opportunity. So blindness and visual impairment, like Dr. Emefa has been saying, are things that are very important and we should get ourselves well acknowledged about it. Globally, the statistics are a bit scary. last year, 2019, the visual impairment statistics for the whole world shows that about 2 billion, I mean billion people have visual impairment across the world. And out of this, about 1 billion of it are impairments that could have been prevented or can be resolved or are not worked on in any way. They are just walking around without knowing that they have any problem. And so that's how huge it is. And if you want to just extrapolate what 1 billion means, just using country size, it's about the size of India or probably China. You can imagine how huge that is, you know. So it's a big burden. If we come down to Ghana, the situation is not that different from the global perspective. In Ghana, we have about 2%, a little less than 2% of our population, that's the 30 million, having some form of visual impairment. That's huge. And out of this, just a little less than 1%, about 0.75% of them actually have very severe impairments leading to blindness. That's huge. Can you hear me, please?
Yes, we can. We're listening.
Yes. So that's how severe the conditions are. And this Ghana statistics is quite recent. We did that in 2015. So you could see that people should take their sight very important. We should try using days like today, World Sight Day, to go check up our eyes and see what the issues are. And MFR has mentioned most of the things that people would need to understand about the causes and what these impairments are all about. We are talking about simple things like refractive errors, getting yourself seen by an eye care professional and giving some intervention that allows you to see and allows your eye to function well. Simple things like your spectacles, simple things like diagnosing diseases early enough so you can have intervention and not totally going blind, as it were, because probably you didn't take the steps that you need to. That's something we can all advocate and have done every year. Usually we say people should check their sight once every 2 years. But if you have any other conditions that are going to hasten the way your sight deteriorates, then you may want to check your sight a bit earlier. And on the public health perspective, like MFA was mentioning, things that are now becoming very, very serious are lifestyle changes and diseases like diabetes and hypertension that are causing visual loss. And these kinds of visual loss are the permanent visual loss that we may not be able to reverse. And a lot of Ghanaians are having to go through these situations. And unfortunately, they find that the visual losses have occurred at stages that we really cannot do so much about. So that's the essence of today.
Yeah, so, but Dr. Ningpe, are there particular areas in Ghana mostly affected? Are there specific places that we need to pay more attention to?
Okay, so from our study in 2015, obviously we found that the most hit areas are the rural communities, places that do not have ready eye care providers who should be available to see. Most eye care providers are centered in big urban communities. Talk of the Accra, the Kumasi, the Sunyani, Cape Coast kind of areas. But moving on into the rural communities, we find less of them, and therefore the prevalence of these diseases and conditions are higher around those areas.
Okay. And just the last thing before I let you go, has COVID brought about anything unusual with regards eyesight? Has COVID-19 affected eyesight?
It's amazing what COVID-19 can do to the total body. There's so much we still do not know about COVID-19. And if you recall, the Chinese doctor who first gave the signal of COVID-19 was an eye person and probably realized that there was this particular infection on his patient's eyes, which were not going with the conventional methods of treatment. And so, yes, COVID-19 can affect the eye, does affect the eye. It's a viral condition, so you can have a viral infection of the eye. Recently in my clinic, I have noticed people who are having swelling on the back of the eye, what we call the retina. It's a condition called papilledema. And we've noticed people who are having papilledema and eventually are COVID. And so it's a myriad of things that we would still need to investigate and see, probably more things that we don't even know about happening with COVID and our eye. Yeah.
All right. Dr. Remi Ningpe, I thank you very much for your time. Thank you for joining us. We've got Dr. Emefa here who will be taking us through some practical things that we need to do. So we will leave you to go and then stay with her in the studio a bit longer. We thank you for your time. Okay. So, Doc was talking about COVID-19 and sites, and I saw you nodding. Is there anything in particular that in your clinic as well that you've seen over this period?
Yeah, we data have established, and I've also personally seen cases where people with COVID came with inflammatory eye conditions, but they are not really sick, you know. Yeah, they were managed and referred for further care.
Okay.
Yeah, but socially, from my background as a public health expert, I have problem with. I'm worried about the people who are blind, but we say social distance. How are they going to, you know? So those are some of the problems it had brought for them. And then all of a sudden they can't do a lot of movements, you know, because you don't know when you are social distancing, when you can't see.
Yeah,
you know.
That's a very important issue you raised there.
Yes. So that again now question our social support system, our user-friendly facilities. You know, so now it's making emphasis to say that we need at every point in time, every construction we are doing, every work we are doing, anything we are doing that needs people have to be user-friendly for those who also have disabilities.
But is that really going down? Because honestly, I haven't even paid attention to it, and I haven't seen any public official, correct me if I'm wrong, who has raised the issue as we've been talking about the protocols and those with disabilities, exactly. Particularly the eye.
Yeah, the eye. Yeah. Fortunately, I think at a point I saw that is why those who do the sign language now tries to use the shield. We have a special mark for them where the mouth area is supposed to be clear. You can't use those marks when you're talking to somebody with
because then they can't.
Because they need to read the lips to understand. So, but for the environment, the social distancing, unfortunately, no. And so we are using this platform to say that anytime we are talking about health, people with disability also have to be considered. So that when we are making the instruction, and it becomes a responsibility for everybody, you know, including those who have the issues, including to our policymakers, those taking the decisions and all that.
Yeah. So
that we imbibe it into our everyday developmental issues.
Yeah. One other thing I want to ask you, because just this week, one of my colleagues, Mapito, couldn't read the news because she just woke up and her eye was itchy. And then I guess over time it got swollen. Why does it happen suddenly like that sometimes?
We have so many causes of sudden blindness. Like, for one thing I always discourage is the habit of always rubbing your eyes when it's itchy. Because the cornea is a transparent surface. When you are rubbing, you can scratch it, you know, then it can end up picking an infection. When we're talking about the hypertension, the diabetes I spoke about, even people with sickle cell can develop sudden issues inside the eye because there are blood vessels in the eye. When there's distortion in perfusion, blood flow and all that, it can affect the blood vessel. If a vessel leaks inside your eye, that is it, your vision will be blurry. You need urgent attention to be treated, which you need retinal specialists, which we have in Ghana, who attend to it. Okay. There are a lot causes of it, but of course you need eye examination to diagnose or identify what exactly caused.
Okay. So if you wake up like that, what's the first aid? Is there anything like that when it comes to the eye?
No. run to the clinic.
Okay.
Run.
Not even the pharmacy?
No. That reminds me. It's a no, 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 no. That habit of going to get eye preparation from the pharmacy, I totally disagree. I discourage it with all alacrity. Because, you know, we are talking about glaucoma, we are talking about causes. There are some medication that can increase the eye pressures in the eye. You know, even we as eye specialists, when we don't examine your eye, we can't tell what is wrong. You know, so typically if you have friends who are eye specialists, you call them, and by the time you describe your problem, we are having about 10 things in our mind that we think is wrong with you. Till we examine the eye. The eye can never be diagnosed spot on. It needs a thorough assessment to identify what is wrong with the eye. Please, Ghanaians, don't buy eye preparations without prescription. They can always get it wrong. They can always get it wrong. We discourage that. And we've seen issues where somebody has allergy and always going to the pharmacy to get some medication for a long period of time before she could realize she was losing the vision. We checked the history. There's no family history of glaucoma. This patient is going blind just because of that error. She was spending, instead of spending some few money for a thorough eye checkup, it's easy walking in and getting medication. You may feel relieved, some get wet, but please check your eye. Be prescribed medication before you apply anything to your eye.
Yes, doctor. Okay, so you have a little simulation exercise that you want to carry out.
Yes, yes.
So in the absence of any other information, shall we get to that now?
Okay, all right, so...
And explain the process so that our viewers can understand.
All right, so well Friday we are doing a blindness simulation. Okay. So viewers at home, when we are talking about blindness, you wouldn't appreciate it till you experience it.
Okay.
But it's easy. Just close your eyes wherever you are and try walking around your own environment. That is blindness. When you close your eye, that is it. And you might even forget the nice pictures you saw before closing your eye. Yes. So the light of the world. I always say the eye is the light of the body. Yes. So
I'm going to be blindfolded.
Yes. So all right. Okay. So walk towards me. All right. So walk towards. Yeah. So that is it. You see, the confidence with which she's been in this studio have been deprived.
This is hard.
She now feels like a stranger in her own office. You see, that's how blindness is. It just stops everything. Everything you do, it slows you. We still provide support for people who may have vision impairment.
Wow.
Yeah, light.
Wow.
Yes. We still provide support for people who are blind. You know, there is a lot of things they do to adjust. But we are also saying we can prevent it. Yeah, this for you.
You know, well, thank you very much. And thank you for doing this. I mean, it's this very brief, but I was just thinking in that brief moment, what if this was it for me the whole time?
And that's what we're talking about. That's what we're talking about. So check your eye once a year. Get your eyes checked. She's so I can see that emotional moment of just do, you know?
Yeah.
Yeah.
I know. Well,
yes.
Thank you.
Yeah.
Is there a free checkup somewhere?
Yeah, so we are doing a free eye test at UPSA.
Okay.
So we can all walk in and get our eyes checked for today. Our other colleagues in their facilities are also doing a free screening. PEMF Eye Care opposite UPS, just walk in and we'll provide you with free eye tests.
Free?
Yes.
Okay.
So PEMF Eye Care is at UPS and at Oyarifa, White House. When you just get to UPS at the Prestige Hostel, we are there. When you enter the UPSA, the main administration block, we are set up then and also providing free eye tests today.
Okay. All right. Thank you, Doc, for being here.
Thanks for
really,
having
really
me.
appreciate this moment. Thank you.